This is Duke University.
I'm Dinushika Mohottige. I am the Chief Resident this year for Ambulatory Medicine and for Duke Regional Hospital, and I just finished my first year of nephrology fellowship last year. This is a long story, actually. I have been here since undergrad, so 2002. I came up from Florida as an undergraduate, was a public policy major, ended up just growing to love this place, and by this place I mean Duke, but also the state of North Carolina. After public health and my medical school at UNC Chapel Hill, I really did give a great look across the country, interviewed at a bunch of different places, but found that this place continued to speak to me on a number of levels. I am just in love with its idea of constantly innovating. I think Duke is really pushing the boundaries on everything. That's global health, research, clinical work. And I was looking for an institution that also was in the center of a place that was really diverse. So Duke kind of has all those ingredients, and the residency training program was strong. Fellowship for me was the same thing. There were so many things about the program that attracted me, so stayed on and have been here since 2002. I think that health starts at home, and health is kind of a global thing. And by that I mean that people's health is produced by the environment that they live in, the landscape that they live in. So that's, where they live, who their family is, and all of those sorts of things. And I also really strongly believe that all the policies that we have at a state level, at a federal level, and at a local level impact people's health. So it was the idea that these things are inextricably linked that made me sort of feel connected to public health, but then ultimately it was feeling like I wanted to have an impact on an individual level that brought me back to medicine. But I'm kind of a public health and population focused person, I would say. The thing that I'm most excited about and has been most invigorating is working with all the new interns who are first kind of taking on their roles as a doctor and being somebody's doctor and seeing the excitement. I think that this job is multifactorial in the sense that I am hoping to instill a sense of passion about the work that we do in every single person that comes in, and hoping to find what it is that makes each individual who's in this program passionate and help nurture that as much as I can. I think everybody here has something really special about them, something that makes them unique and a great doc, and I want to find it, learn about it, and nurture it. Probably the most moving thing in the last decade or so for me was during my residency global health period when I was in Sri Lanka at one of our sites there. It's at a big tertiary care hospital. Seeing patients, seeing diseases that we honestly don't even have to think about, like leptospirosis, dengue fever, and then more importantly, just reflecting on something that is my training home is in nephrology, but watching people die of kidney disease when I know that in this country the same exact people wouldn't be dying of kidney disease was profoundly moving. We have so much work to do in terms of dealing with inequalities in health in this country as well, but this was kind of a move and shake me kind of experience from abroad. There's not a day that goes by in this job also when we're not humbled by something. I feel like every single day I can think about a moment, either you were thinking about a certain diagnosis and it was something else, or something about someone that you're taking care of sort of surprises you. The amount that we learn from our patients, I never stop being amazed by that. It is just tremendous, and I think that there's something to be said about reaping the joy in that too, those really powerful connections that we're so fortunate to have, particularly in internal medicine, where whether it's a 1-week hospital stay or a longitudinal experience of taking care of somebody in the clinic and you see them over years and you get to know their families, this is the joy. I think this is part of the great joy of this job. I think we have few moments to reflect on it. I think it's really important to reflect on it.